Cases involving retinal detachment that we handle at Kaire Heffernan usually come from two different categories. One is trauma or an accident that causes a retinal detachment, and the other is medical malpractice cases where a doctor either fails to diagnose and treat a retinal tear or a retinal detachment, or a doctor does a surgery to correct a retinal detachment that is done through an improper surgical technique, or something goes wrong during the surgery that leads to the patient having complete blindness, loss of vision of the eye. So first we'll talk about cases involving trauma. Those cases can involve anything from a car accident, a trip and fall accident where somebody falls and hits their head. Direct trauma to the facial bone can lead to a retinal tear or a retinal detachment. From there, we've got cases involving medical malpractice where the patient who just had that trauma can present to an eye doctor, an emergency room, and the doctor fails to appreciate the fact that the patient has a retinal detachment. If left untreated for a period of time, scar tissue will form, and that will make it irreversible, and the patient will suffer complete blindness if left untreated. Also, we talked a little bit about cases where a doctor does diagnose a patient with a retinal detachment and performs a surgery to try to reattach the retina, and the surgery is done in a manner that leads to less than optimal results. Those are cases involving medical malpractice where sometimes we've got to pursue a cause of action against the doctor who performed the surgery for medical malpractice.